Yeah, I'm Stuart Dickson. I'm one of the intensive care consultants here in Plymouth, and my background is also in clinical infectious disease. So at the moment there's lots of talk in the media about Omicron variant being much less severe, and while that's certainly true at a population level, there's absolutely no doubt that the transmissibility of this virus, the infectivity of this virus is much greater. That means that we are all going to come across this virus in our everyday life in the weeks ahead. There is absolutely no doubt whatsoever that some individuals will be unlucky enough to need hospitalisation and intensive care as a result of COVID infection in the weeks ahead. For those who haven't been vaccinated before, you are at significantly greater risk of being hospitalised with your COVID infection. So if we look at the national data, then approximately 61% of patients nationally in intensive care units with COVID infection are not vaccinated. Here in the southwest, about 65% of our patients are not vaccinated in the intensive care unit, and certainly if you look at some of the occasions over the last month or so, the numbers here in our own intensive care unit in Derford have been as high as 80% at times. So there's certainly a very significant dominance of unvaccinated people in the intensive care environment, both locally and nationally. So patients who are admitted to intensive care with COVID disease typically come here because of a very severe viral infection affecting the lungs, requiring assistance with their breathing, and the worst case scenarios with ventilation. Some of the sicker patients go on and develop multi-organ failure, and some of those sadly do die. If we look at those who are unvaccinated, the majority of those patients do not have any significant chronic disease process, and so the only reason they're really here with their severe COVID infection is because they haven't been vaccinated. So patients who come into intensive care, it's a very difficult journey for them. They're coming to intensive care, they know that they've got severe COVID infection, they know they're coming to the COVID intensive care unit, and the first thing they see when they arrive here are patients who have the same disease as them, who are very, very sick. And so patients coming into the intensive care unit, it's a very terrifying experience for them, and our staff spend a lot of time working with them and reassuring them and doing a fantastic amount of work to look after them in those first days here in the intensive care unit. As the patient settles in and starts to talk to our staff, quite often the unvaccinated patients start to inevitably feel some degree of regret for the decisions that they've made in the past not to be vaccinated. And occasionally the nature of COVID is not just an infection which affects the individual, but often whole households and families are affected at the same time. And it's it's not an unusual situation to find patients whose family members have died during their time here, and so often there's some very complicated psychological issues to work through, because often patients who choose not to be vaccinated, it's often the whole household that choose not to be vaccinated. So recovery from COVID for patients who have been sick enough to be in the intensive care unit is often very prolonged and goes well beyond their time in hospital. So these patients often will spend many months in the community recovering before they can go back to work. So some of our very first patients who we saw right at the beginning of the pandemic, almost 2 years ago, didn't go back to work for a period of 12 months. So it can have really quite a devastating impact on the lives of those affected. Yeah, so there's absolutely no doubt that even in the face of the Omicron variant, which is now dominating the clinical picture, that vaccination remains the very key intervention which reduces the risk of both hospitalisation and admission to intensive care units. Even at this stage, looking to get a first vaccine if you've never been vaccinated before begins to build the immunity that you require, and certainly a single vaccination can reduce that risk by 30%, and completing 2 vaccinations if you've never been vaccinated before can reduce that by 60%. So it really is not too late. So please reconsider getting that vaccine. No one is going to ask about the decision you made 6 months ago. We'll just be very pleased to see you and very pleased to discuss any issues you've got about vaccination. Just make that appointment and come and see our vaccination teams.